I gave a dummy name. Yes. Yeah. Yes. So Dorcas, this is squamous cell carcinoma. Yes, Dorcas, you can start once you're comfortable. So you have to unmute. Yeah, unmute.
I said card number 6. I sent a message to you.
Card number 6.
Yeah, I sent a message to you on WhatsApp.
Okay, okay, fine, fine. Okay, I'll do that for you. Road accident. This is the one, eh?
Yeah, road accident. Oscar Fidelity Road.
Okay, fine, fine. I'll change it later. No problem. Yeah. Routing meeting controls. Yes.
Mm, 806.
Yeah. Road accident. Yeah, road accident. Fine.
What's the patient's name?
You can take it, John.
John, okay.
Yes. You can start once you are ready.
Okay. Hello, good morning, John. My name is Dorcas, and I'll be looking after you today. I understand you've been through quite a lot. You've been involved in an accident. First of all, I want to know how you are feeling at the moment.
Yeah, nurse, I am really very anxious and upset. I don't know what's happening with me. I am little bit worried, nurse.
Thank you for sharing that with me. I understand how you are feeling at the moment, especially when you've been through involved in an accident, and I'm here to support you all through the process. Can you please tell me more what concerns you the most?
Yeah, I know that I had an accident in the road, on the road, and I was not seriously injured. I know that also, but I have lot of blood. Okay, so I was told that I need some blood transfusion. I don't
Okay.
know what the procedure will involve, and I am little bit upset. There may be some problem, I am afraid of contracting HIV.
Oh, thank you for sharing that with me. I completely understand how you feel, especially when it involves blood transfusion. But I'll just want to reassure you that the risk of contracting any infection, including HIV or from a blood transfusion, is extremely low. Currently, now that there's advanced technology in how blood is being taken and how it's being transfused into an individual. Every unit of donated blood is or goes through a rigorous testing to ensure that the HIV, such like HIV, hepatitis, and other infections are checked. And also, strict screening procedure is being carried out before it's being transfused into it from a before it's being transfused when it's being collected from a donor. So we only give transfused safe and healthy blood is being transfused into any patient that needs blood transfusion.
Yeah, but I need a clear explanation, strong, authentic explanation from you, because I don't know anything about the procedure and the risks involved. Will it be any harm for me? What are the effects and side effects? Everything I want to know, please.
That's very good, and your concerns will be addressed one after the other. Blood transfusion during your accident, you lost a lot of blood, and the reason why the doctor has recommended a blood transfusion. As I mentioned earlier on, before a blood is being transfused into a patient, it has gone through a lot of laboratory investigation to ensure it is safe, and and all the safety procedure is being undertaken, such as like the needles that is being used, the tubings, and ensure that it is sterile. And also during the transfusion, there will be close monitoring to ensure that it is safe while it's being done. And it's only a trained staff that is going to undertake the blood transfusion process. If there's any point you feel unwell during the uh, transfusion, we will respond with it immediately.
Yeah, that's fine. And so what else? Um, so how do I know that my life is secure and safe without any problem? Tell me more about the. There may be some side effects. Maybe my body will not accept the foreign blood, or there may be some side effects or reactions. So for that purpose, how can you? How can I confide in you?
That's a very good question that you have asked. And as I said, we are in this process all together, and all the safety precautions that is involved in blood transfusion is being considered. And while the transfusion is going to take place, we're going to use all this instrument we're going to use is a sterile procedure from collecting the blood from the donor and it is being transfused into your body. There's going to be a continuous monitoring of your vitals, such as your blood pressure, your pulse rate, your heart rate, your temperature. All will be documented to ensure that there's a smooth transfusion of your blood. And the entire process, I want to assure you, is painless. Although you might feel tired at the beginning or after, which is a normal thing that happen, but in few hours you in few hours that the blood is taken, you'll be fine and there won't be any issues. And I said again that trained staff are going to be the one to do the blood transfusion for you.
Yeah, that's very nice. Thank you very much, nurse. You have given a clear-cut explanation. I am very confident now. Thank you very much for your guidance.
You're welcome.
Yeah, that was very excellent. Very nice presentation. You were very confident. Sounds great in the beginning itself. You have sound knowledge on the subject and the topic which you are talking. Maybe you have done a lot of blood transfusion cases you have dealt with, so it is very clear that it reflected, that knowledge reflected here. And then presentation was excellent, right? Fluency was fine. You managed well from the beginning to the end. Accuracy, yeah, as every time, similar to the every time. Today also you have, this time also you have done very well. Okay, there was no flaw, there was no problem in your accuracy. Grammatical errors, very rare. And then grammar variation you have exhibited, you have shown that variation. So Yeah. So that
Thank you.
variation part you have done well, and pronunciation is good. It's not confusing. So some people, if they speak, there may be some problem to understand because of accents. But you are very clear, no problem. There one or two places, okay, it was little difficult, but still that was fine. It was not a hindrance to understand your message. It was very clear. Go on doing like this every day. Practice regularly. That will help you. That will definitely support you. Do you have anything to say?
Nothing at the moment.
Yeah. So fine. That's good. So you have done three speaking sessions. All the sessions are there online. You can watch them and you can improve. You can see the others videos also. They will definitely help. My feedback also is there. You can go through them. So here you could have said like, you are in safe hands. There is nothing to worry. The hospital takes all the measures, relevant measures, to see that there is no infection or problem. The patient's safety, health, and hygiene are our fundamental responsibility. We will leave no stone unturned. We will leave no stone unturned. That means we'll take every chance. That's the meaning. To safeguard your health and avoid all the probable risks. Only then we do this procedure like that. Something you can
Okay.
improve the quality. Is that clear now?
Yes, yes.
Yeah, that's you did well, no doubt regarding that. But I'm giving you an edge of it. One more sentence or two more sentences. That's it. Nothing less. Okay. Right.
Okay. Thank you.
Right. 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 Next, Tamil.